Hello friends, I am Prabhjot, your occupational therapist, and today I'm going to continue the topic of using Chewy tube with children. Last time I covered the topic of oral sensory use of the Chewy tube, and today I'm going to focus on the oral motor, which is strengthening the oral musculature. Usually, the child will tend to hold the Chewy tube with their teeth. Instead, how do we encourage them to use it with their lips? Because lip closure is equally important. Ask them to show their teeth. E. So they hold it with their lips and then they try to blow it out. This encourages blowing. This encourages lip closure completely around the Chewy tube, and it is also helpful in desensitization because of the knobbly nature of the stem of the Chewy tube. So you can ask them to hold it in different parts of the lips, not just the center. So in this way, you are working on the desensitization or the lip closure throughout the length of the lip. Next, you can work with moving the Chewy tube in the mouth between the teeth, because now you're going to work on biting. Initially, you just tell the child to hold the Chewy tube in the mouth, ask them to open the mouth, and then you pull it out. But later on, it has to be turned into a sort of resistive activity where you try to pull it out, but the child tries to hold it as much as possible with their teeth. Please take care of the dentition of the child depending on at what stage the child is. These activities are more helpful if the child is 3 years and older. Younger children may not be able to cooperate with this or understand the instructions well. Just the way you did it with biting with the front teeth, also encourage towards the sides, which is the canines. And later on, the resistive. Then you provide the same movement towards the molars, because that is exactly where chewing is supposed to happen. So, chewing does not happen directly. The child needs to learn to move their tongue towards the side. So first the child takes a bite. The tongue moves the food towards the side and then the chewing action happens. So how do you encourage this? Provide the Chewy tube in the center and you can tell the child to push it towards the side. Okay, let's try again. Encourage them to do it towards both sides, because most of the kids are used to eating only with one side or chewing only with one side. So encourage them to push it both towards the left as well as the right. Next, we are going to work on the sides towards the molars. Provide the Chewy tube, you hold it and ask the child to just provide chews on it. That's good, and again practice it on both sides. Once the child learns to do this while you are holding the Chewy tube, leave the Chewy tube, place it on the side and ask the child to hold it while they are chewing. So in this way, the child learns to keep the food inside, chew on it in a continuous manner, the rotary action of mastication that is supposed to happen. Again, practice it on both the sides. The child has to prevent the Chewy tube from falling out of the mouth. That is the only aim. So see, first they might do it for 3 chews, then 5 chews, maybe 10 chews. Once the child becomes comfortable with the Chewy tube, you can provide small slices of fruits to them like apple, which are easy to chew, or banana, so that even if they apply a simple force, the minimal strength possible, they'll be able to bite on it, try to push it towards the side and then After chewing, they can swallow it. This automatically reduces the gag that your child is facing, the texture sensitivity that your child is facing, because you're introducing different textures of food. Don't forget to like the video and subscribe to the channel. Add any queries or suggestions in the comments below, and do share the video so that maximum parents benefit from it. So we'll meet again soon. Bye.